The HIV and AIDS pandemic has contributed very negatively to the social and economic aspects of nations. It especially represents a significant threat to people with disabilities who are not usually included in HIV and AIDS outreach efforts locally and internationally. HIV and AIDS kills millions of people worldwide. Sub-Saharan Africa is the world's worst affected region. As a result, AIDS is a leading cause of death in Africa. Too often, individuals with disability have not been included in HIV prevention and HIV and AIDS outreach efforts, as it is assumed that they are not sexually active, yet they have equal or greater exposure to all known risk factors for HIV infection. Being deaf has its own struggles. Being deaf and HIV positive is an even greater challenge.
We have challenges. Many people have negative attitudes. They are sensitive and they don't even want to socialize. Even friends think they'll get infected. And also, you see, being jobless, how do I take care of myself? It's a challenge when I go begging or think of prostitution, yet I'm positive. Many people think I'm HIV positive since my husband died of HIV and AIDS. They have a negative attitude and even reject me. They say, she has AIDS, but I just persevere. Even the deaf have the same negative attitude. They point at me saying, it's true, she has AIDS, but I'm different.
In Dandora, a low-income area in Nairobi, Kenya, the rapid spread of the disease amongst the deaf has compelled Dandora Deaf Self-Help Group to find ways to address this issue among its members.
The Dandora Self-Help Group was started a long time ago as an idea borrowed from the hearing. We got a few deaf people to form a community-based organization in 1997.
Poverty and unemployment have left the youth with a lot of idle time.
We have the deaf youth who, because of lack of employment and the responsibilities, of course, they have, if they can't meet these responsibilities, they end up abusing things like alcohol, which is, as a result, predispose them seriously to HIV and AIDS.
I get odd jobs, and when I'm paid, I spend the money on alcohol. I drink because I'm jobless, and it helps relieve my stress.
Employment for the deaf will translate into better living standards for their families, better nutrition for those with HIV and AIDS, and access to better health care. Communication and information regarding HIV and AIDS in Kenya is tailored for the hearing population, totally excluding people who are deaf. Lack of information and understanding on HIV and AIDS, therefore, is a barrier to people who are deaf in accessing proper medical services.
I don't think the deaf community has so much benefited in the messages around on AIDS, because some of them have not managed to go to school and so they cannot read. And if it is just seeing on the TV maybe or on programs which are going around, they are not able to hear. So we find that they have been left out.
When you tell them about AIDS, they know AIDS is there, and when it comes to being positive and negative, they don't know the difference. When you tell them you are positive, meaning you are lucky, you are sort of healthy, and when you are negative, you are having less, which means you are not positive.
In the healthcare system, we need to restructure it to accommodate the deaf people by mostly probably training most of the health workers on the deaf language in order for us to dissect into the deaf culture. If we understand the deaf culture, health workers would be able to formulate structures that will help these people in the preventive health and curative health.
Through workshops, Dandora Deaf Self-Help Group facilitates training of health workers on basic sign language and creating deaf-friendly services. A skit performed by members of the group gives a glimpse to what happens when the deaf visit a health facility.
We are here now as health workers to come and help these people access our healthcare services within a very simplified way.
Name, yours, who, you, seek, where. This one for married. You.
We also train the church, health workers, police, and parents in sign language to break the communication barrier.
Sign language is being encouraged, especially among service providers. Buruburu Sign Language Center is one such initiative by Dandora Deaf Self-Help Group.
Way of communicating with deaf people. The trainers will have different trainers at different levels. One amongst whom is Josephine Kalonda, who is also the project manager for the Dandora Deaf Self-Help Group.
My work, I found some challenges, especially when it came to dealing with the deaf people. Understanding one another is very hard. So that's why I decided to come and at least learn sign language to enable me break the barrier.
Alternative treatment is occasionally sought by people who are deaf because of the communication hurdles they face in health facilities.
I'm a herbalist. I assist the deaf. Because the deaf from this area cannot communicate with hospital doctors, I know how to communicate with them through sign language. Even when their children are sick, they come to me.
I have encountered that by the time they reach to me, they have probably passed through two different categories of what we would call health workers. Some are herbalists, some have even gone to witch doctors.
The group, which is housed by the Salvation Army Church, with support from Handicap International Kenya, has formed a pool of peer educators for their outreach programs, especially matters related to HIV and AIDS.
Our peer educators are trained in matters related to abstinence, the use of condoms, home-based care, and prevention of mother-to-child transmission.
What started as door-to-door visits has now grown into a fully fledged community outreach program with a special emphasis on peer education and counseling.
In 1997, we got a certificate, and the group has expanded since then.
One of the goals of Dandora Deaf Self-Help Group is to alleviate poverty by encouraging them to start income-generating activities.
Deaf people have lived in poverty for a long time, and therefore, one of our objectives is to reduce poverty levels.
Many members have benefited from the income-generating initiative. Through this, they are able to propel their lives forward, thus being useful to the larger society and more so to themselves.
My employees have different skills. Some are specialized in sofa sets, beds, and other furniture. The work goes on well, and we have many customers. But the deaf workers get only 15% of the business, since we have hearing carpenters who negotiate with customers, and so we lose out because of communication barriers.
Literacy levels among the deaf are exceptionally low, with women forming the biggest percentage. They therefore engage in small-scale businesses due to lack of skills and adequate capital. Thus, the struggle to break the poverty cycle is a grim reality.
10 women from Dandora Deaf Self-Help Group came together and contributed some little money to start a weaving project. We are trying our best and would like to continue working. Within the Dandora group, we have a membership contribution. We get some little money from the kitty to buy wool for weaving. This is my business. I sell clothes and shoes. The Dandora Deaf Self-Help Group granted me the initial capital. I do business for 3 days a week, and since I'm also a peer educator, I work for another 3 days teaching deaf people about HIV and AIDS.
Reaching disabled individuals with HIV and AIDS messages, as well as clinical care, present unique challenges. Even when AIDS messages reach them, low literacy rates hinder comprehension. Global literacy rates for adults with disabilities stand at 3%. Communication tailored specifically for people who are deaf is required to address issues pertaining to HIV and AIDS.
The media does not consult people with deafness when coming up with some of the gestures or signs that they use for these anti-HIV/AIDS campaigns. Like there has been the campaign in the media of young people flashing two-finger salute, meaning to chill.
The chill message has brought a lot of confusion. When they see the chill sign, in sign language it means open. When the youth flash the two-finger sign on TV, the deaf understand it as being ready for sex.
Constant review of existing media programs can assist in developing approaches that can help create advocacy materials for people who are deaf. The visual medium, when tailored for them, is a powerful outreach tool.
If it is any material in relation to ARVs, which has a lot of information, should be made in a language that the deaf people can understand.
With 1.3 million persons living with HIV and AIDS in Kenya, voluntary counseling centers, VCT sites, were established to give affordable HIV and AIDS testing, promote behavior change, and improve access to information about the disease. Liverpool VCT is at the forefront of establishing VCT services tailored for people who are deaf.
One day I visited a VCT. I wanted to find out my status, whether I was positive or negative. The counselor counseled me on the importance of using a condom, taking ARVs, and eating a balanced diet. I was tested and now I know my status. I'm HIV positive. My husband died of HIV and AIDS. I was shocked. With time I forgot about it. Then I went for the test to find out if I was positive or negative. To my surprise, I turned out negative, even though my husband was positive. Now I'm left alone to take care of my 3 children.
Deaf persons being part of the wider disabled community are actually vulnerable to HIV and AIDS. If we are to succeed in the fight against HIV and AIDS in the country, we therefore need to take their needs into consideration. The intervention HI has had is working with the Dandora Self-Help Group, a group of deaf persons who have come out themselves to actually want to fight for their rights and fight for access to HIV/AIDS services like VCT services, services in regards to opportunistic infection.
Our organization has different objectives. One of them is to serve the deaf people. The services include quality voluntary counseling and testing. We also provide HIV and AIDS information to the deaf to help them understand their HIV status.
Actually, I felt very bad. I wanted to commit suicide. I just wanted to die. Fortunately, I was cancelled and I got to know it's possible to live for 15 to 20 years. I now understand my status.
We work with different organizations like the Kenya National Association of the Deaf, Dandora Deaf Self-Help Group, among other organizations of persons with disability.
Handicap International Kenya and Liverpool VCT are among very few organizations at the forefront of establishing VCT services tailored for people who are deaf.
I'm here to know my HIV status. And I also understand the meaning of VCT. It means voluntary counseling and testing. I voluntarily came here, nobody forced me. Now that I've been cancelled, I want to undergo the test to know my status.
The Dandora Deaf Self-Help Group is passionate about the work they are doing for the community despite the challenges they face. A lot more still needs to be done to improve services to the deaf.
There is need for massive awareness and an inclusion of deaf programs in almost all government and private sectors.
Currently, we know we have policies in regards to HIV and AIDS. Unfortunately, the policies have not been very friendly to persons with disabilities, meaning that it doesn't incorporate their needs. It's until sometime last year that we had the National AIDS Control Council form a task force that is now looking into the needs of persons with disabilities and trying to incorporate it into the HIV/AIDS policies that we have.
Dandora Deaf Self-Help Group works with other organizations in building partnerships that incorporate people who are deaf.
Life is very hard when you have a disability and then you test HIV positive. So that's how we have come up with the Papercraft project, whereby we are making envelopes. Some of the deaf women who are working in the project are from Dandora Self-Help.